Hi, my name is Dr. Nikki Hoffman. I'm an assistant professor in athletic training at Illinois State University. I just wanted to give you a little bit of my background so you have an idea of where I'm coming from as a former clinician, as well as from the standpoint of a current researcher and professor. So I worked clinically full-time as an athletic trainer in Division I athletics for about 8 years prior to transitioning over to academia. My research interest includes sleep and concussion recovery. So today I would like to share my knowledge in the area of acute concussions, and I will be presenting on the importance of sleep and optimal physical activity levels after concussion to improve symptom burden. With respect to conflict of interest disclosure, I have nothing relevant to disclose. So to go over some of the learning objectives you can expect to learn, by the end of this presentation, you will be able to identify effects of poor sleep and low physical activity in healthy young individuals. Then we'll go into analyzing the prevalence of sleep and wake disturbances following concussion, and then examine early benefits of physical activity on symptom burden in the literature. We will define physical rest and examine conservative management guidelines following concussion. And then we'll finish up with interpreting how current findings are being utilized to develop treatment strategies throughout recovery. And I'll also provide some examples of treatment strategies that I've used personally in the clinic. So that should be able to give you an idea of how best you can address sleep and physical activity following concussion. So we will start this presentation on what these effects look like in healthy individuals in order to then understand what it looks like in an individual with a concussion. So let's start off with sleep. Why do we care? Well, sleep is gaining more attention in the NCAA based on current evidence that shows the benefits on athletic performance. We know that sleep is an essential component of health and well-being. And it has a significant impact on not only physical development, but also emotional regulation, cognitive performance, and quality of life in general. So I want you to start off by thinking what you feel like when you get little to no sleep. So some of the things I would typically experience would be maybe like a headache the next day, maybe some nausea, difficulties concentrating, maybe some difficulties staying awake throughout the day. So if this is how we feel when we don't have a concussion, could you imagine how someone would feel with a concussion who isn't sleeping well? So most of this presentation will focus on young adults. I wanted to start off with some general statistics on what we actually know about sleep, or quote unquote lack thereof, sleep in young adults. So just think of just in general, poor sleep hygiene. So meaning maybe their bedroom environment and daily routines that promote sleep are fairly inconsistent. So ultimately, sleep isn't a priority. They tend to use technology right before bedtime. They're on their cell phones throughout random hours of the night. Maybe their room temperature is too hot or too cold. So maybe they live in the dorms where they don't have the capability of regulating that temperature. So that ultimately could affect sleep. Also, some individuals may find themselves studying in their beds. So all of these represent examples of poor sleep hygiene. Now, towards the end of this presentation, I will give you some examples of how to address this, especially if you work with the college population. But I thought we could at least get an introduction on what do we actually know about college students and sleep. So they may demonstrate erratic sleep patterns, like I mentioned before. So that in combination with poor sleep hygiene as well as poor sleep quality, that's going to ultimately lead to inadequate sleep and increased daytime sleepiness. We also know a little bit about sleep deprivation in college students is associated with poor decision-making and impaired cognitive function. So students may struggle in the classroom, especially if they're not getting enough sleep, and that could ultimately affect like poor decision making and maybe with respect to their time management down the road. So this is something that tends to happen quite often. Many young individuals are not getting the recommended amount of sleep. So this particular age group, they should be getting about 7 to 9 hours per night, according to the National Sleep Foundation. I'm not sure about you, but I don't know too many college students who actually get 7 to 9 hours unless, or at least every night, unless they're trying to what we call catch up on their sleep on the weekends. So at this point, they're already being set up for potential prolonged disturbances, and that potentially could be increased risk of depression, diabetes, obesity, and even cardiovascular disorders. So essentially, sleep plays a crucial role in maintenance and restoration of cognitive function, but it's often set aside as a low priority, as we've been talking about earlier. One study done in 2010 showed that college students who experience multiple nights of sleep deprivation commonly exhibit not only increase in self-reported daily symptoms, as we've been talking about before, but they also have been demonstrating poor balanced performance, as well as poor overall neurocognitive function restriction. So you can see kind of like a pattern that ultimately it's not just affecting their schoolwork, but potentially it could affect other decisions as well. So that's just a brief overview of sleep in healthy individuals. So what about physical activity in healthy individuals? Well, physical activity improves not only one's physical ability, but we know that it generates positive physical perception, and it even promotes psychological well-being. So physical activity is an important contributor to the reduction in mental health disturbances. So one study done by Trost et al. Found that those individuals who did not really participate in physical activity that much, they demonstrated higher levels of cognitive depression and as well as higher levels of emotional symptoms. So this is going to play a large role in individuals who have a concussion, where we end up pulling them out of activity. They potentially are at risk of these types of results. So I think it's important to at least recognize, what does it look like if we're not working out regularly, especially for those who are used to working out, what are they potentially dealing with? So once again, higher levels of cognitive depression and emotional symptoms as well. So another study done by Dinger et al., they found that individuals who were more physically active demonstrated a higher quality diet. They were having better sleep habits, maintain a healthier weight status. So we do know the benefits of physical activity. And some other things to consider, since we were talking about sleep earlier, is that acute and regular exercise does have some form of effect on sleep. So by Credlow et al., they found that regular physical activity was shown to reduce sleep disturbances, including they were able to sleep longer. They didn't take as long to fall asleep. They were more efficient at sleeping, and they had fewer instances of waking up in the middle of the night. So with respect to perception of sleep quality as well with regular exercise, they also found an association with daytime functioning. They had better life satisfaction and fewer mental health symptoms. So we can see there's a connection with physical activity and sleep in healthy individuals, but what does it look like for concussed individuals? So let's start off with symptom burden following concussion. Some common signs and symptoms that many of my patients complained of following a concussion included, as I mentioned before, headaches, dizziness, nausea, difficulties concentrating. These tend to be a little bit more the more regular ones I've come across personally. So like many of you, I always got the question, how long will it take for me to get better? And how long is it going to take me to feel like I'm actually normal again? So a lot of that depends on numerous factors, such as risk factors for prolonged recovery that we have to take into consideration, such as how many previous concussions have they had? Do they have a history of mental illness? So that's something to consider that may affect how long it may take for them to get back to activity. Another question to consider is whether they continued with physical activity after they had the head impact, or whether they stopped right away. And also, did they have repeated head impacts in a short period of time? So those are all some things to consider. And unfortunately, we don't have that magic number of, oh, you'll be back in 7 days. Unfortunately, my favorite saying is, once you've seen one concussion, you've seen one concussion. So it's very variable. And that's why it's really important to understand what types of symptoms are these patients experiencing, and is there a way for us actually to lessen that symptom burden as they recover? So when I examine my patients, I focus on not only the severity of the reported symptoms, but also on how many symptoms they were reporting, because evidence shows that the greater symptom severity post-injury is often associated with the increased odds of prolonged symptoms. So if somebody is presenting with maybe like a symptom severity score of, I don't know, like 16, they might be able to recover a lot sooner than somebody who, let's say, reports a symptom severity of like 40 to 50. Now, is that going to be the case with everybody? Absolutely not. But it's one thing to at least consider when you're examining symptom burden following concussion. Now, the one thing I wanted to point out, this isn't just my type of approach. There are recent concussion guidelines that support this approach, since the most consistent predictor of concussion recovery is not only the severity of those symptoms, but also how many symptoms are they reporting as well. So you definitely, when you're examining symptom burden, make sure that you're looking at the number of acute and subacute symptoms, as well as the severity. So as I go throughout the rest of this presentation, I want to make you aware that when I'm defining acute, basically there's so many variable definitions in this term, but this presentation is going to examine the acute phase as within 0 to 7 days post-injury. So with respect to concussion management, what exactly are we doing right now? So according to consensus guidelines, they're recommending academic modifications, cognitive rest, as well as limiting physical exertion. But what exactly do they mean by limiting physical exertion? So we're going to talk about that a little bit as we get more into this presentation. We know that initial symptom burden predicts concussion recovery, but maybe sleep can actually help decrease that symptom burden. Sleep management may be the missing puzzle to aid in the concussion recovery, along with identifying the optimal physical activity timing following injury. So you can expect that's what we're going to talk about more so in the next several slides. So overall, what do we know about sleep post-injury? Well, we know that changes in sleep quality and quantity are common during recovery. I can personally attest to sleep disturbances following concussion. I've had multiple, unfortunately, but sometimes I would fall asleep quickly right after a concussion, but then I would wake up multiple times throughout the night. And then other times it took me a significant amount of time to fall asleep, anything basically over 30 minutes. So yes, as clinicians, we know that patients may report trouble falling asleep or even sleeping more than usual following concussion, but we are basically overlooking the prevalence of these disturbances and how they may negatively affect symptom burden. So instead of simply asking them, using that typical checklist of, do you have trouble falling asleep? And like I said, are you sleeping more than usual? Don't just note that as like, oh, that's a symptom that they're reporting. That might actually give you some more information on, well, if they're actually, I'm noticing a pattern on this, maybe I probably should ask a little bit more about sleep to potentially decrease symptom burden during recovery. So if we examine sleep disturbances following concussion a little bit more in the literature, we can find that up to 50% of concussed young adults are reporting short and long-term sleep problems, potentially chronic fatigue, excessive daytime sleepiness, as well as vigilance disturbances. So for example, insomnia. So whether that's trouble falling asleep or trouble staying asleep. Additionally, evidence supports that concussed young adults commonly experience acute sleep variation in their total sleep time and sleep fragmentation. So for example, a patient may experience sleep poorly overnight, then they try to make up for it by taking naps throughout the day, which then may lead to difficulties falling asleep because they were sleeping mostly during the day. So it's essentially like a vicious cycle. I would typically encourage my patients to avoid taking naps closer to bedtime. If they wanted to take a nap, I would have them set an alarm just so that they were at least trying to establish a little bit more of a routine of sleep throughout the day. Otherwise, some of them will sleep completely throughout the day. They might take a nap at 1 and then find themselves waking up in the middle of the night. So that's something that I would encourage my patients to at least set an alarm, because they want to make sure that they're still eating as well. So that's something to kind of get them in a routine. Now, regarding sleep fragmentation, patients may have a couple of nights acutely following concussion where they have difficulties falling asleep, but then you find that they're sleeping more than usual throughout recovery. So I haven't been able to identify too much of a set pattern with sleep disturbances, but what we do know is that they tend to be greater in individuals following concussion compared to what we would consider our typical college student who doesn't sleep well anyways. So basically, I wanted to present this evidence to say that we just really don't know why this is occurring. But this is something that's important to at least try to figure out what your patients are experiencing with respect to sleep disturbances, and if maybe you need to address that to help them decrease their symptom burden. So if we look at the sleep variation further compared to healthy individuals, we can see that concussed individuals typically take longer to fall asleep, about 2 to 3 days post-concussion. If you take a look at the graph on the upper right aspect of your screen right here, even within the first couple of days, there's a significant variation on how long it takes them to fall asleep initially compared to looking at 4 to 5 days post-injury. So you can see this significant variation. Each of these lines represent one person. So as I mentioned before, some individuals may take a lot longer to fall asleep. So basically sleep onset latency, once again, that's how long it takes the individual to fall asleep with the intent to fall asleep. And you can see individuals down here are falling asleep within minutes. An average amount of time for a healthy individual to fall asleep should be about 15 minutes. But you can see with our college students, a lot of them are falling asleep a lot quicker anyways. So you can see that days 4 and 5, once again, pretty much are a little bit more consistent. And then look at days 6 and 7, you're starting to get some more variability. So why is that the case? We're not quite sure, but we do know there is a lot more variation. And if you look at this graph down at the bottom here, you can see a little bit more consistency among individuals who are college students, but at least it's more consistent than it is following concussion. So I just wanted to point that out, that it's something to consider, that yes, we already know that college students aren't sleeping well, but if we're comparing what we call like a typical college pattern, and taking a look at what it looks like following concussion, there are significant differences. So that's something we might need to consider with respect to sleep variation. Now, when considering sleep prior to injury, so this is what we've been talking about is following injury, you may ask a question, well, what do their sleep difficulties look like before injury? Well, for those concussed individuals, another study that examined the pre-concussion sleep difficulties, they found that those individuals experienced more severe symptoms at several time points throughout recovery. So we know that greater symptom severity potentially could be a predictor of prolonged recovery. So maybe it might be a matter of, should we be considering what their sleep difficulties are like before they get injured? So that might be something to consider adding to pre-participation exams. So going back to this study by Sofrenko et al. In 2015, they found that those individuals who had those pre-concussion sleep difficulties had more severe symptoms at 2 days, 5 to 7 days, and 10 to 14 days post-injury compared to the healthy controls. So once again, sleep disturbances really aren't getting the attention that they should be, but we do see that they do contribute to symptom burden following injury. So here's another example of sleep disturbances post-injury. This graph is from a large multi-site nationwide study that was conducted a couple of years ago that examined symptom severity in individuals based on their sleep change. So meaning the difference between their sleep duration the night before their injury compared to their sleep the night after their injury. We found that individuals who had sleep declines at night, acutely following concussion, they exhibited a higher symptom severity. So for example, if they slept less following injury compared to the night before the injury, that would be classified as the shorter sleep group. Then those individuals tended to experience a greater symptom severity. So if you look at this graph that I have right here, trying to find my, there we go, trying to find my mouse. You can see that the symptom differences between groups at that 24 to 48 hour time point. So you can see we've got the no sleep change and then the longer sleep compared to those who were sleeping less after concussion. Basically, that they were experiencing a significantly greater symptom severity. So, and we even noticed this if you take it a little bit further for individuals who are at the 2 to 4 days post-injury as well. So now the study didn't show any differences based on sleep duration once patients were symptom-free, defined as asymptomatic. However, it may still be important for clinicians to address symptom severity and sleep early on to potentially decrease the symptom burden throughout recovery. So that's pretty much what we're dealing with, sleep disturbances following concussion. So what does physical activity look like in the literature? So another area that researchers are looking more into is looking into post-injury is early aerobic physical activity. So recent studies are challenging the utility of prolonged rest as treatment for concussion. Patients who normally live an active lifestyle, as I mentioned before, and who are used to working out regularly, and you tell them to discontinue their usual activities for prolonged periods of time, these individuals can experience symptoms such as like withdrawal, lethargy, and other symptoms of depression that closely mimic the symptoms of concussion. So when we are dealing with emotional symptoms throughout concussion recovery, something you want to consider is it actually the emotional symptoms as a result of the injury itself? Or is it because we're holding these individuals into a state of prolonged rest? So that's something to at least consider further. So historically, the standard of care after concussion was largely predicated upon experimental animal studies, which they identified a decrease in energy availability in the brain resulting from neurometabolic disruption. So this meant that rest should essentially help with energy conservation. It was speculated that activity after an injury might actually exacerbate the metabolic dysfunction, potentially increase symptoms, and ultimately delay recovery. So however, we're actually finding that some form of gradual physical activity may have its benefits compared to strict rest. So I'm going to go into the next slide, providing an example of strict rest versus usual care. So according to consensus guidelines, 24 to 48 hours of symptom-limited cognitive and physical rest, followed by then a gradual increase in activity is recommended at this point. Unfortunately, we just don't know what that means in terms of how much activity can they do safely. So we're learning that prescribed rest may have detrimental effects similar to social isolation. That's what I was talking about before, is initially we wanted them to rest in theory, using that energy to actually go towards healing as opposed to, cognitive and physical activity. A study done a couple of years ago examined strict rest of 5 days compared to usual care. So usual care was defined as clinical recommendations that were set by an attending physician at the time the participant was admitted. And this would include your typical cognitive and physical restrictions. Now, the strict rest group, basically, they received recommendations from that treating physician, but their discharge instructions were that they had to maintain 5 strict days at home. They weren't allowed to go to work. They weren't allowed to go to school, basically no social interaction or even participate in any physical activity. So the findings showed that the participants experienced a decrease in symptoms after that initial 1 to 2 days of rest, followed by a gradual return to activity, compared to those individuals who were told, stay home, don't do anything. So if you take a look at this graph that I have on the slide right here, the vertical column is the mean daily symptom scores compared to the horizontal axis, which is the number of days post-injury. So if you look at that time period from 1 to 10 days, you can see that both of those groups actually did gradually decrease in their symptoms. But the strict rest group experienced greater symptom severity during that recovery. So that's why we're thinking, you know, maybe some form of light physical activity might be beneficial to these individuals so we can bring their symptoms down and maybe they might be able to progress at a little bit better rate. So what I basically want to say is that with respect to the strict rest, a clinical take-home point for you is that this strict rest may inherently lack efficacy over our current modest rest recommendations. Therefore, maybe we need to start considering finding ways to gradually implement aerobic physical activity following concussion. But the thing is, we have to decide, okay, well, when do we start? So I have some studies to kind of explain this idea of what's going on in the literature. So emerging evidence is documenting a protective effect of early physical activity in the management of concussion. As I've mentioned before, according to our recent guidelines, evidence is supporting that we begin a gradual increase in activity as long as we stay under that symptom exacerbation threshold. But what exactly does this look like in the literature? So when can we start? When is it safe? There's a couple studies that demonstrate that sub-symptom threshold aerobic activity does improve recovery in acute concussion. So let's take a look a little bit more into this. So when we say aerobic exercise, is there a preference on the mode of exercise? Are we thinking about, should we have somebody jogging? Should we have somebody on a bike? One study by Lawrence et al. Basically looked at use of standardized stationary bike. And what they did is they had the participants perform a physician prescribed aerobic exercise involving this bike protocol. And essentially they chose the standardized stationary bike protocol because it not only minimized the amount of head movement that you're having, it also minimized the amount of acceleration that the brain would be at risk for within the skull. And it also controlled the increasing levels of exertion and intensity. So it sounds like a pretty reasonable approach. Their protocol, along with the stepwise progression, they were held at a minimum of 2 sessions that they had to tolerate well at each level before they can begin their progression. So let's basically take a look of this, this protocol that I have right here in the middle. So based on Lawrence et al. Study, they had these are concussed individuals who began light physical activity. They were placed at the first level of riding for 15 minutes, but they had to maintain 100 to 120 beats per minute. After 2 successful sessions were tolerated by the patient, then they could then progress to the 30 minutes, staying at that 100 to 120 beats per minute. Once again, after they successfully passed that landmark, then they stayed at 30 minutes, but then they were able to increase to 140 beats per minute. And then the final stage of this exercise protocol included a 1-minute max sprint every 5 minutes, then totaling 30 minutes. So this is just one example of once patients were deemed by the physician as safe to at least participate in that sub-symptom threshold aerobic exercise, this is what they started with. So some things I do want you to keep in mind. I don't want, you basically to go out there and say, okay, well, we're told that we can do an exercise protocol. I'm just going to kind of make up my own. Right now, we don't have a set standard of protocols, but I just wanted to present you with an idea of what we're currently looking at. But some other things to consider is whether a patient is actually ready to begin this sub-symptom threshold exercise, you have to consider other factors as well. So I know I mentioned those risk factors for potential prolonged recovery. I want you to keep in mind that, when you're determining whether it's a good idea for your patient to begin this exercise, also consider the number of their previous concussions. Consider whether they are experiencing that higher symptom severity that we talked about before within those first 1 to 2 days of concussion. Also, did they experience a loss of consciousness as part of their mechanism of injury? So these are all really important to consider when monitoring the progression of the patient, with the notion that they may not tolerate physical activity well, depending on these factors. And that's why it's important to work closely with your physician to determine if this patient is, can safely proceed with this protocol. So that was an example of Lawrence et al.'s exercise protocol. Another study done in 2018 found that early physical activity is associated with a lower risk of persistent post-concussion symptoms. So that's pretty ideal to consider. Furthermore, another finding that they examined was that basically for each successive day and delay to initiating that aerobic exercise post-injury, they found that individuals had a less favorable recovery track. So basically what we're saying is that those individuals, as long as they started their early physical activity within that 5 days post-injury, if you waited each day after that point, essentially they're saying they might have had a less favorable recovery trajectory. So they're saying early is better, but more evidence is needed, obviously. So additional preliminary evidence focusing on aerobic exercise following concussion has found success with a slightly larger time frame to begin physical activity, where they found that aerobic exercise within the first week, so they're basically saying within those first 7 days, doesn't appear to actually have that associated detrimental clinical outcomes when they're comparing to a concussed group, who didn't perform an exercise post-injury. So this slide is showing a comparison between concussed individuals who were exercising versus concussed individuals who didn't exercise, and they just performed your standard treatment approach. So basically, the decision to exercise was made by a medical provider, as we've noticed a pattern with this, based on their clinical presentation. So ultimately, that has to stay consistent with current consensus guidelines. But the question is whether they believe the patient can tolerate subsymptom exercise. So I'm not going to place all of my patients into a subsymptom threshold aerobic exercise. There's some other things that you still need to consider on an individualized basis. So this study particularly, they said aerobic exercise involved either cycling on a stationary exercise bike, or they actually permitted light jogging on a treadmill. I know the majority of the participants were on the stationary exercise bike, but light jogging could potentially be an option on a treadmill, so a clinician can watch the patient and monitor for any increase in symptoms. So the participants in this study completed exercise bouts at a level which did not provoke symptoms for 10 to 15 minutes at a self-selected pace under the supervision of a clinician, as I mentioned. If they reported any form of symptom presentation, then they stopped prior to completion of the protocol. If the symptoms improved the following day, then they would go ahead and resume that same protocol. So I think this is very interesting. The first study that we talked about was talking about early physical activity within 5 days post-injury. This one's saying potentially the first week post-injury. So right now we know that there are some benefits to beginning subsymptom threshold physical activity, but we still aren't quite sure what that optimal time frame is. One thing I do want to point out that I thought was really interesting from this study is that whether the participants in this study were able to tolerate exercise because they started with that lower symptom severity compared to the individuals who were in the no exercise group. So if you take a look at this image on the left, you can see Once again, this vertical axis is the symptom score. You can see individuals who were in that exercise after concussion group during their initial evaluation started with lower symptoms than the exercise after the no exercise after concussion group. So I believe the authors stated that there really wasn't a significant difference between these two, but clinically, is this something that we should at least consider when making a decision whether a patient is, ready to begin the exercise with, higher symptoms. So, with respect to concussion management, we talked about what physical activity and sleep look like after concussion. What treatment strategies can we consider moving forward now that we know that sleep and symptom limited physical activity does have some benefits to decreasing symptom burden? So first question would be, do we continue with strict rest? Well, we know that there are no clear guidelines for how much rest is beneficial, but we do know based on current concussion or current consensus guidelines that the first 1 to 2 days of rest is beneficial. Ultimately, we do tell our patients that you're supposed to rest after concussion, but how much can be too much? So we know that strict rest after 5 days, yes, they did end up progressing and feeling better, but it took a lot longer than those individuals who were able to resume activity a little bit sooner. My next question for you to consider is, what is rest? Should we be telling our patients to sleep? Should we be telling them to, kind of take it easy? That's basically where my area of interest and research is. Well, maybe sleep, maybe that's something we should be encouraging our patients to do. I'm sure you've heard the approach, the cocoon therapy approach. This essentially was the idea of shielding individuals from all forms of mental stimulation or physical activity for those extended periods of time. Basically similar to the effects of social isolation, as I was talking about before. So the goal initially was to reduce the demands on the brain at a time of decreased capacity and vulnerability. But what we are finding now, studies are showing that this approach could delay recovery. So we can confidently say that too much rest, not ideal. Some form of physical activity could be beneficial, but we still need to identify how much is good. So as I mentioned, cocoon therapy, not the way to go. On the opposite end of the spectrum, we know that too much is not good either. So if they resume strenuous levels of physical activity and cognitive activity, we know that that can exacerbate symptom burden. So if it takes a while for your patient to actually tell you they sustained a concussion, they kept attending practices, lifting sessions, kept going to classes, don't be surprised if their symptom burden is a lot worse than when they first, experienced the head impact. Once again, one of the things I want to consider is that sleep with respect to concussion management may decrease symptom burden acutely post-injury. So that's something we potentially could look more into, as well as any form of early active interventions after concussion. They have the potential to prevent some patients from going on to a prolonged recovery. Okay, so what should we do to actually facilitate this recovery? So I'm going to go into management techniques. Future research is needed to identify ways to address sleep disturbances post-injury. As I've mentioned before, sleep hygiene may be a way to consider sitting down with your patients, especially if you're learning that they have really poor sleep habits. I remember working with an athlete who said that it took them, I think they couldn't fall asleep until 3 a.m. On a regular basis. And then they had 8 a.m. classes, which I don't remember whether they made it to their 8 a.m. class, but regardless, that's not an ideal sleep hygiene. So maybe that's something you could sit down and address with your patient is, developing tips on healthy sleep patterns. So I do have a link on the next slide that will take you to some potential advice or education that you can provide to your athletes to address that sleep hygiene. Another way to also consider concussion management is to capture their sleep, not only subjectively, but also objectively. So we know that some clinicians may consider just giving a sleep questionnaire on, how do you feel like you're actually sleeping? Well, their perception of sleep is usually a lot different than what information you can capture with respect to sleep objectively. So that could be an example of maybe a Fitbit or some other Apple Watch that could track their sleep. Granted, it's not research quality devices, but it could shed some light on sleep patterns that could give an idea on how to advise your patient in this area. Right now, we may ask about sleep duration on a physical, but more information should be considered based on what we've been talking about throughout this presentation. There are several subjective sleep quality questionnaires out there that can be beneficial to include in a pre-participation exam. I'm not going to give you specific ones that I use, but I would be happy to address some examples if you want to email me after this presentation. But I will give you some example of the information that is captured in these types of questionnaires. So that's pretty much with respect to what can we possibly do with sleep. But what about that physical activity? So we know that future research is needed to address that optimal timing and intensity of aerobic physical activity. So far, what we've seen in the literature is there are benefits less than 5 days post-injury. So is it okay as long as you start anywhere between 2 to 7 days post-injury? So right now, what we do know is that we're able to decrease a patient's symptom burden acutely within at least 1 week post-injury, but the optimal timing still needs to be further explored as long as we're staying within that sub-symptom threshold. So that's like the key thing to take away from today is if we're considering beginning early aerobic physical activity, you have to stay within that sub-symptom threshold. So with the intent that we're going to be introducing activities, but it's not going to exacerbate their symptoms. Maybe you just want to encourage them to resume their activities of daily living. One of the things I used to always have my patients do is, walk around campus. One of the places that I worked at was a larger campus. So encouraging individuals just kind of take a walk around, get them light exposure. If they're in the sun, that's probably going to make them feel a little bit better. So it might be simple as just having them do, walking around campus. That could be an option. Definitely non-contact light aerobic exercises we've talked about before. We still need to know more information on is a stationary bike an ideal way or light jogging. So more information is needed on that. And also just make sure it's a clinician supervised environment with daily assessment just to kind of track their progression. So at this point, given the available literature, ultimately we can't conclude recommendations for clinicians to utilize this approach at this time, but we are on the right track to showing there are benefits of the early subsymptom threshold aerobic activity. So how do you practice good sleep hygiene? So I wanted to talk about different strategy techniques with the sleep hygiene. Some things to consider are signs of poor sleep hygiene in your patients. You can simply ask questions such as, are you having difficulties falling asleep at night? Are you experiencing frequent sleep disturbances? Are you suffering from a lot of daytime sleepiness? If you're just having information, just you're gathering from a normal conversation, then maybe it might be a good idea to sit down with some education techniques that they can practice, making some adjustments. So I'm going to go ahead and bring up this link. It's from the sleepfoundation.org. You can even just Google different ones through the Sleep Foundation. But it has a lot of really good information, ultimately saying what are some signs of poor sleep hygiene. Those are some examples that I just gave you. So if you notice this in your patients, maybe that's something that you might want to sit down with them and find out a little bit more information. Some advice I like to give to my patients following concussion are setting a sleep schedule. So I know I mentioned that before. That might be something that you really want to encourage, that if they want to constantly sleep throughout the day, that they're going to have to set an alarm to at least get them in this routine. Have them have a fixed wake up time. This was something that was really beneficial for me following concussions. So whether it's a weekday or a weekend, try to get up at the same time, trying to establish that normal sleep pattern. Now, are you going to be able to make all of these changes immediately in your patients within a couple days? Absolutely not. Trying to change bad habits is going to take a while, but at least is something that you can work on, giving them suggestions that they can at least try. Make it important that they prioritize sleep. Encourage them to make gradual adjustments. So maybe target one area to fix first, and then they can start changing some other things. Otherwise, it's going to be a struggle and probably nothing's going to work. Big thing, especially following concussion, don't overdo it with naps. So this is what I was talking about. If they're napping a lot during the day, then they're most likely not going to sleep that well at night. And then you're in this vicious cycle where it's going to lead to more daytime sleepiness. Some other things to encourage is just try to keep your routine consistent at bedtime. Definitely unplug from electronics. That's usually the recommended of building in a 30 to 60 minute pre-bed buffer. Try to get them off of their cell phone, tablets, laptops, anything that's going to generate blue light that could decrease that melatonin production, which makes it difficult to sleep. Some other things I've talked about is maybe if they need to calm their mind down before they go to bed, maybe some form of relaxation techniques. And also, this is another big thing, especially when they're trying to make changes early on, is don't toss and turn. So basically get them out of bed. If after 20 minutes they haven't fallen asleep, just kind of get up, stretch, maybe read or do something else in low light, and then return to their bed and see if they can try again. This tends to be really difficult following concussion. So you can just encourage your patients to take it easy, not get frustrated, just to do the best that they can. And eventually it does get easier over time. Some other things in terms of cultivating healthy daily habits, this is what I was referring to earlier, is getting that daylight exposure. We used to place patients in, a dark room and say, you don't need to have that light because that's going to make your symptoms worse. I actually told them to get outside, but if they needed to wear sunglasses and a hat, that is something that I have personally found success in. This one says be physically active. That's not for individuals who are concussed. That's more of like a general rule of thumb if you're a healthy individual. I did encourage my patients to cut down on caffeine, especially if they're big coffee drinkers, to kind of get away from that a little bit. Optimizing the bedroom, encourage them to have a comfortable mattress. If they're in the dorms, I recognize this might be a little bit hard to do, but maybe getting like a mattress topper that could potentially help. Also make sure if they can adjust this, once again, if they're in the dorms, this might be difficult, is to set a cool yet comfortable temperature. They recommend that your temperature in your bedroom is about 65 degrees Fahrenheit. So if anything warmer than that, they may have difficulties falling asleep. So you definitely want to have a cooler environment to sleep. Drown out noise. I know that's not always the case, especially on weekends where they might be dealing with parties nearby. So once again, just do the best that you can. So the idea of sleep hygiene, it's not the same for everyone. It's definitely an individualized approach. So that's something that you need to sit down with your patient on an individualized basis. But what I've been doing with my patients is sitting down with a brochure on some of these techniques and then just kind of going over it with them before they leave the clinic. So that was a lot of information on sleep hygiene. Once again, I went through that pretty fast, but if you have any questions, feel free to reach out to me. So we talked about sleep hygiene. That's one way to address concussion management. What about those sleep measurements that I was talking about before? So this slide provides some examples that I briefly touched on. Subjective questionnaires, yes, that can gather a lot of information on how they perceive their sleep quality to be. The next slide, I have some example questions. Have them keep a sleep diary. That actually might give you an idea of the variation that I showed you in one of my studies earlier. Are they experiencing that sleep variation? The objective measurements, actigraphy, that's essentially the form of like Fitbit and Apple Watches that I was talking about that examine movement. So that's how they actually assess sleep. What they do is they provide continuous monitoring of sleep and wake activity based on that movement I was talking about over extended periods of time. So that's really interesting information that you can learn about sleep more. If you are really concerned about sleep, potentially referring them to a sleep clinic for further testing and using polysomnography. And that's essentially the gold standard of measuring sleep. So you can go into a sleep clinic and they'll hook you up with a sleep monitor and whatnot. So what the polysomnography does, it combines measures of airflow, heart rate, blood oxygenation, and muscle movement. So definitely a lot more detailed information if you needed to capture more on sleep. And then the multiple sleep latency test that essentially just measures how long it takes the individual to fall asleep over several 20-minute nap opportunities. So gives you a little bit of it, an idea on how long it takes to fall asleep. And then advanced technologies, you might have to get neuroimaging or even like a spectral electro encephalopathy, excuse me, EEG. I'm saying that wrong for today. I apologize for that. So those are just some examples of sleep measures that you can consider for concussion measure or management. Now, these subjective questionnaires that I was referring to earlier, these are used to identify sleep disturbances across a wide range of age groups. So these are just some examples of questions you might be able to ask your patients. I actually modified this particular one to target since your concussion only. It was originally developed to assess for sleep over the past month, but essentially it gathers the same idea. So for this case, since your concussion, how often have you had trouble sleeping because you cannot get to sleep within 30 minutes? So then they were able to identify since their concussion, no, I didn't have any difficulties, or are they experiencing it 3 or more times a week? Another question is, how often are you having trouble sleeping because you wake up a lot in the middle of the night or early morning? And they can also indicate using that same scale. And then another one examined just your basic chance of dozing. So this is more of like a sleepiness scale. So what is your chance of dozing while you're sitting and reading? So 0 meaning you don't have any chance of dozing, where 3 it's like I'm pretty likely. And same thing with watching TV or even just sitting inactive. So these are some types of information that you can gather from your patients to learn more about their sleep. The actigraphy, not expecting you to be able to look at this image on the left and know exactly what's going on. But essentially the groups of the dark marks, that dark grouping is they're moving around, they're awake. And then that period that you can see, let me see if I can show you. Like right here, for example, this is where they potentially were sleeping, and then those spikes are that movement that they demonstrated. So actigraphy does give us a lot more information on sleep. So they measure how long it takes the individual to fall asleep, how well they were sleeping, how long they were sleeping, how many times they were waking up in the middle of the night, as well as wake after onsets, after sleep onsets, how many times were they waking up after they first fell asleep. So this actigraphy is basically the Fitbit that I was talking about. It can give us a little bit more information on sleep. So with respect to concussion management, validated protocols for physical activity. So I've gone over a lot of different examples of sleep. But I wanted to address some validated protocols that you may have heard of and you may have questions on. So these are sample subsymptom threshold graded exercise protocols for persistent symptoms. So that's the one thing I wanted to make you aware of. You might have heard of the Buffalo concussion treadmill test. I know that it was initially developed to see if they can diagnose a concussion. post-injury, but essentially it has been utilized by researchers and some clinicians for individuals who are experiencing symptoms for at least 3 to 4 weeks post-injury. So they're at risk of that persistent, prolonged symptoms. So in this protocol, they have the treadmill. It's a standardized treadmill test, and they take the incline that is progressively increased while the patient walks on the treadmill, and then the level of perceived exertion and symptoms are then taken every minute. So you can see an example of a perceived exertion rating on the image on the right. So the patient's heart rate and blood pressure are then assessed every 2 minutes. And then this protocol continues until symptoms increase significantly or the patient reaches his or her maximum perceived exertion. So I think we are hoping that we could potentially use this acutely, but as of right now, this is more of a persistent symptom validated protocol. So the clinical bottom line, excuse me, when considering subsymptom threshold aerobic exercise based on current evidence, patients should be referred to a supervising physician before implementation, and you must use your clinical judgment to determine the proper timing post-injury. So right now we're at an individualized approach with early physical activity, which is why it's important to work with your physician. So it's important to note that this information is not to supersede any current consensus guidelines, but it does highlight best available evidence where the literature is taking us. Early aerobic exercise has been shown to be safe and protective in improving recovery time following acute concussion. However, more evidence is required to provide a detailed evidence-based exercise prescription approach. Other areas that we need to consider include the optimal type of activity. So that goes back to, are we doing a standardized stationary bike, light jog on a treadmill, anything else that we can consider. We also need to explore a little bit more on exercise intensity, duration. As you saw before, we started on one protocol where they started at 15 minutes. Another one said we kept them at 10 to 15 minutes the whole time. So that's something to consider. What is the ideal intensity and duration? And also the time to initiation following that acute concussion prior to implementation of this treatment strategy. These are my references. If you have any questions, please feel free to contact me via email. Thank you so much for your time, and I hope you found this information helpful.